Hello, my name is Efrain Talamantes. I'm an assistant clinical professor at the University of California, Davis in internal medicine. I'm also the co-director for the Center for a Diverse Healthcare Workforce. One of the ways that I've thought about post-bac programs is through mentoring and having students who many times either they themselves have felt like they're going to give up or others have given up on them. Really having them use a post-bac as a second chance and a real opportunity. And now as a physician, I get to train many students who have completed post-bacs, and they're some of my best medical students and best residents. And so I think that I see the value of us not giving up on these students because they do bring a lot more experience. Oftentimes they're more mature, they're a lot more focused, and they make great doctors. And I think that's one of the key reasons for me to study this population. In mentoring students who come from, let's say, maybe families where they have role models already in medicine, well, it's easy to sort of know exactly what steps to take to get into medical school. But oftentimes if you go to a university, big university, you get overwhelmed by all the options. You may not necessarily know exactly what classes to take. And so, if you don't plan it correctly, you may not necessarily do as well in some classes, or you may not take them as seriously yet because you're not fully committed to a career. And so a lot of times students who end up choosing a post-bac are students who are career changers, for example. And so they started off thinking, I want to go into this field, but somehow found their calling in medicine and now want to go back and really focus on their pre-medical requirements so they can do really well. Anecdotally, these programs for my students have been very beneficial, but studying them now more broadly and following students over time will even give us more information as to how effective these programs are in helping students, especially students, again, who come from underrepresented medicine backgrounds. In this work, one of the big questions I get is what type of post-bac program should I complete? Whether it be an informal post-bac, let's say 20 hours versus 40, or a formal post-bac where someone gets more support resources. And our study really aims at trying to better understand how much of a post-bac students need. Obviously, that's a very individual question, but at least we can get a better sense of how to advise students and saying, well, from the data, we could see that students who complete X amount of hours are more successful across the board when they get into medical school. And so that's a very important question that will help us better mentor and advise students as they apply and think about going to med school.